Hi, my name is Anupama Koirala. Today I'm here to have a PPT presentation about Herpes simplex keratitis and Acanthamoebia keratitis and the anatomical structure related to it. Let's have a background about the ocular anatomy, Acanthamoebia keratitis and Herpes simplex keratitis. So the anatomical structure affected by these two microorganisms is eye, especially the cornea. Cornea is the vascular structure. It is supplied by trigeminal nerve. So there are different layers of the cornea which is going to be affected because of these microorganisms. So the epithelial layer of the cornea it's get attached by the tear film mucin layer. Here we have five layers of the cornea. First one is the epithelium. So it is composed of squamous epithelial cells and it is extremely sensitive to pain. It can regenerate and the mucin layer gets attached to this epithelial cells. And next one is the Bowman's layer uh, which can't regenerate once it's damaged. Another one is the stroma which also can't regenerate and the scar is formed. And the cementous membrane, it provides a protective barrier under stroma and it can't regenerate after injury, whereas endothelium is the last layer of the cornea. And once it's damaged, they do not also regenerate. And it has got an endothelial pump which helps in the ions and electrolyte balance in the cornea. Talking about the Acanthamoebia keratitis, they are caused by the Acanthamoebia species, which are eubiquitous, free-living microorganism. So the T4 strain is responsible for causing this causing this amobia infection, and also it acts in two forms: cyst and tropophoid. Cyst is a dormant form, whereas tropophoid is the vegetative form, feeding on keratocytes of cornea and other algae and bacteria. And in adverse situation, the trophozoites can form cyst, even as for more than 24 years. Talking about the herpes simplex virus, it belongs to the alpha herpes pylori family. It is also ubiquitous and it has got its isohedral shaped capsid and DNA virus. So man is the only known host and reservoir, and there are two types of HSP. HSP1 and HSP2. HSP1 causes the herpes simplex keratitis in more than 95% of the cases, and it's the number one leading cause of blindness. So there will be so much of corneal complications, especially the dendritic lesions, and trigeminal nerves gets affected here. So the mode of transmission in acanthamoebic keratitis is the contact lens wear in 90% of the cases, and also the other factors such as trauma, bathing or swimming with contact lens, disruption of the corneal epithelium, contamination of contact lens with lens solution, or the use of tap water or the saline water. So these all are the causes or the virulence factor for the transmission. Here we can see the different factors responsible for the pathogenicity of the acanthamoebia. So there are various factors which affects directly and the indirectly ones. Starting with the pathogenesis of acanthamoebia, due to exposure to the various virulence factors. The acanthamoebia goes to the or invests to the corneal epithelial cells by mannose glycoprotein. Then there will be secretion of the cytolytic proteins, and also it will put an cytotoxic effect on the corneal epithelium cells and keratocytes, and further corneal penetration may occur by migrating along the corneal nerves. So the first clinical features is like dirty epithelium, which occurs within the first 2 weeks in 50% of the patient. Then there will be the stromal infiltration within the first 2 weeks, and then there will be the ring infiltrates or Wesley immune ring within the first month in 20% of the patient. After that, there will be the perineural infiltrates in the first month of the disease. And then sterile anterior uveitis, which is the late symptom. Uh, So the important differential diagnosis is the herpes simplex keratitis, bacterial and the fungal keratitis because of the involvement of the epithelial and the uh, ring infiltrate. In treatment part, the aim should be like eradicating trophozoites and cysts, uh, preventing recurrence. The begonia, they are the first line of treatment. So what they do is they just interact with cytoplasmic membrane, causing the loss of the cellular components and respiratory enzymes. The side effects could be corneal vascularization, and in surgical, it will be like epithelial debridement, cryotherapy, and keratoplasty. So in terms of herpes simplex keratitis, talking about the virulence factors and mode of transmission, the disease is spread by the tears, saliva, or genital secretions. There could be the primary infection, which is usually seen in children, and the recurrent infection, which is usually associated with the physical or psychological stress or other factors which would put down the immunity, and the virus becomes latent in primary. Talking about the pathogenesis of herpes simplex virus, first of all, there will be the spread of the HSP due to direct contact, and there will be primary infection. After that, the virus migrates, and then the latency is established, and it remains asymptomatic. After that, it becomes secondary or recurrent infections. Um, then this causes viral reactivation, and the virus will set in cornea, and this causes the massive destruction of the epithelial and the endothelial tissue, causing herpes simplex keratitis. So in treatment part, there has been the different recommendations. So the drug of choice is the oral acyclovir as per the FDA. So with ulcer, without ulcer, it can be managed accordingly. Also, the corticosteroids can be used as topically, and for prophylaxis, antiviral therapy can be used. And the surgery could be the another option, uh, such as penetrating keratoplasty or permanent trachography. As shown in the figure, for the sample preparation, we can use the corneal scraping biopsy, and microscopy can also be used. So here are some of the figures for the direct microscopy, where there will be the staining of the cyst and the trophozoites. Furthermore, in vivo confocal microscopy can be used in order to image the structure of the disease in the cellular and the subcellular level. So this is very nice technique in order to find out the damage caused by this virus. So as far as the staining is concerned, LPCV stains can be used for staining cyst walls, and here the nuclei looks blue and the cyst wall also look blue, cytoplasm is pale blue. Acridine orange can be used where there is the bright orange staining of the cyst. Calcium white can be used where there will be pale green cyst, and trophozoites can be reddish brown and silver stain, and hematoxylin and iodine can be also be used. Also the immunohistamine antisera can be used against the Acanthamoebia group. So culture is the another technique, and it remains the gold standard method For this Acanthamoebia detection, it will take 24 to 48 hours to a week, and the slide is investigated using the inverted phase microscopy, and they develop cyst in about a week. So subcultures can also be produced for further investigation. So here is the figure where we can see the trophozoites of Acanthamoebia. So PCR is the another technique in order to detect the virus by using the amplification process of the fragment of the 18S RNA. Um, and this remains more sensitive method to detect the DNA. They are using like two primers and T4 reference range genotype is also used to reference it. So the multiplex real-time PCR, it is very sensitive and specific test that may be run as a singleplex for AK diagnosis. So the laboratory techniques starts with the sample collection. It could be the sample like corneal or epithelial cells, and it could go for culture. So here we can see the figure of the staining of the culture showing the viral activity, and we can also stain showing the giant multinucleus. So microscopy such as bright field microscopy can also be done. Here large multinucleated giant cells is indicated in the figure amongst the normal cells. Here in this technique, fluorescence microscopy, virus detector will emit the green fluorescence, and another one in vivo and confocal microscopy, it can take the imaging of the entire cornea except uh, the disseminatus membrane. So here we can see the figures of the normal and the abnormal corneal layers. Here are different types of serological assays, such as agglutination assay, Western blot assay, fluorescence immunoassay, ELISA. They all detect the viral antibodies in blood in different ways, so especially the glycoproteins. So polymerase chain reaction or PCR, so it can be used to amplify the viral genome, and it can target a specific section of the genome using different primers. So basically the Tagman probe or cybergreen can be used. Cybergreen is like it shows the fluorescence. This is a really good technique to detect the virus with high sensitivity and specificity. Here we can read the bands by using the agar gel electrophoresis. So in Acanthamoebia keratitis, making the general analysis of the different methods used, uh, PCR was found to be more effective and sensitive, uh, with the sensitivity more of sensitivity and specificity than other methods, but it's like expensive, and it may get contaminated while doing the procedure. So whereas staining and cultures, even though they were gold standard, they were easy and rapid to do, but they has less sensitivity and specificity. Also, the IVCM has been effective way with sensitivity and specificity of 70 to 100%, 100% with high sensitivity and specificity, but they require the expertise to do this procedure. For herpes simplex keratitis, by analyzing different laboratory tools, uh, there was high specificity and sensitivity for PCR, and also it could be done within uh, 24 to 48 hours. It was like, but very good technique for detecting the virus. But then the disadvantage or limitations could be like the samples could be infected, whereas the cultures it also was good technique to detect the virus, but it requires the special considerations while carrying out the samples or transporting the samples. So here is the further comparison of the different HSV assays for HSV1 and HSV2 for the diagnosis. So concluding, uh, Acanthamoebia species and Herpes simplex virus, they can cause adversely effect on the cornea, but I think Herpes simplex virus is more severe than Acanthamoebia, and also the little bit difficult to treat, but the um, most useful diagnostic test is the real-time PCR for both of them. So as soon as the laboratory diagnosis could be made, the treatment could be really good, or the outcome would be really good for the patient.